share screen. Let's see if it is this. All right, how's that look, everyone?
Great.
Awesome.
That's awesome.
Well, again, welcome everyone to NAFCON's webinar. We are the National Alliance for Filipino Concerns. The topic this evening is our Bayanihan response to COVID-19. My name is May. I'm the co-coordinator of NAFCON, and I live here in Queens. I believe, let's see.
And my name is Mike. I am also the co-coordinator of NAFCON. And I also live in Queens, but not originally from New York. I'm actually from California, but live here now.
Yes, and I'd like to walk everyone through, again, welcome everyone, some etiquette. Hopefully everyone is learning how, just like me, is learning how to navigate, Zoom and webinars. Everyone will be muted, and unless they are speaking, we will have all the questions queued up in the chat box. So feel free to write your questions as they come up in the chat box, and we'll have a Q&A later on in the program. And just to remind everyone that this webinar is recorded and it is being live streamed on Facebook. So I wanted to share with you why we're taking this time. This is the very first time that we are actually able to centralize just the chronology of what has been happening as this campaign has been launched, and the situation that's been happening here in our neighborhood. So we want to share with you the details of why we decided to launch the Bayanihan response to COVID-19. We want to be able to make sure that we get the information out to those that need this information, because there is a lot of information out there, and we recognize it could be very overwhelming. So we want to provide a source of support. And in that sense of support, we want to come together in the spirit of Bayanihan, that we, are collectively united as one, and that we provide action-oriented initiatives to support our kababayan here in New York and New Jersey. For our program this evening, we will be introducing NAFCON, what is the National Alliance for Filipino Concerns. We'll go over the campaign. We'll also have 3 resource speakers, Dr. Ryan Huerto, who will be talking about COVID-19 and how to protect ourselves. We'll also have Laura Gregory Esquire, who will be discussing the topic of eviction and moratorium, as well as other rent matters. We'll have Dominique Flores, who will give a testimony of her experience of working the front lines. Again, as I mentioned, we will have a Q&A. You're more than welcome to add any questions that you have in the chat box. We will be addressing those a little bit later. And we'll also be sharing what the calls to action, how we can get involved, and that will be it. We plan to end around 8:30. So with that, I would like to pass it on to my co-MC, Mike Luat.
All right, so what is the National Alliance for Filipino Concerns? So basically, we're a national alliance of Filipino organizations, institutions, individuals that respond to the concerns of Filipinos in the United States and in the Philippines. So we create a action-oriented platform that brings people together through culture, heritage, education, health and wellness, and advocacy. All right. So a little bit more about NAFCON. So NAFCON was founded in December 2003. Before this, the light of 9/11, there was like some anti-immigrant sentiments that were happening. So in order to we brought together a bunch of organizations that were fighting for the rights and welfare of Filipinos during that time. Hence, like why it was kind of founded in San Jose because of like the airport screeners that were being laid off. There was mass layoffs after 9/11. So in 2003, we actually came together. We formed the National Alliance for Filipino Concerns. Sorry. Okay, so since the founding of NAFCON, we have tackled a lot of immigrant issues related issues like deportation, labor trafficking. We had also taken on concerns of Filipino workers like workplace discrimination and wage theft. NAFCON members have won over $1 million in unpaid wages through the campaign of Filipino caregivers, hotel workers, and others. So through conferences and leadership training, NAFCON also has engaged and empowered United Filipinos youth across the country. We educate the youth with a large community on our history, culture, and current issues affecting Filipinos in the United States and the Philippines. So as we see here with like the Bayanihan relief and rehabilitation and the medical missions that we have here that hit the Philippines is prone to like all these disasters, right? Natural calamities that happen yearly over and over again. So NAFCON actually responds by donating relief efforts to the Bayanihan relief and rehabilitation during like Typhoon Haiyan was one of the big ones. Also Typhoon Ondoy, and currently and previously this year was the Taal eruption. So we have gathered like efforts of donations on what we could do to actually help our kababayans at home. And then we also, do a annual like medical mission in the Philippines as well. But however, since the COVID virus has like hit the Philippines, there's been a lockdown. No one can go in, no one can go out. We are postponing it until next year. So if you are someone in the medical field, and would like to go to the Philippines and help out in certain areas that are that need the help, we do urge you to sign up with us. All right, move on to the next one. So these are basically our memberships across the nation. So we have a few in California, Oregon, Washington, Utah, Texas, Hawaii, Chicago, and of course, the best coast, the Northeast, which is New York and New Jersey. Okay, so moving on to, so basically we have these pillars, the 4 pillars, like we may mentioned earlier. If you, are about cultural and heritage, basically we preserve and celebrate rich Filipino culture and ensure a comprehensive understanding of our heritage. The other one is education. So we empower our community through community-based learning, engagement, including workshops and integration and training, just like this one. And also our health and wellness. Basically, we want to promote and give access to sustainable and culturally humble healthcare. And an awareness to to the underserved Filipino communities in the U.S. and the Philippines. So the last part is advocacy, which is like we want to engage our communities to participate in the actions to protect the rights and welfares of Filipinos in the U.S., the economic prosperity and peace in the Philippines. Okay. Okay, and so we also have NAFCON also has this thing called the points of unity. So basically, it's basically we want to empower the Filipino community in the U.S. The second one is to preserve and celebrate the Filipino culture and heritage. The third one is to promote the rights and health and well-being of Filipinos. And the fourth one is the advocacy for Filipino communities in the U.S. and marginalized communities in the Philippines. So basically, if any of these points of unities do align with what you or your organization or anyone that you know that does work for their community, you can also become a member of NAFCON. So as an individual or organization.
Thank you, Mike.
All right, back to you, May.
Great. So now that folks have been more familiarized with our Alliance Filipino organization, we are ready to dive into, why NAFCON decided to launch this campaign. So just to share, as of today, based on the study from St. John's University, the data has said that there are 988,000 cases in the United States. There are 287,000 cases in New York State, and there are 1,100,000 in New Jersey. We recognize that we are, in the scale of what the epicenter is of this crisis, this pandemic, that New York is the epicenter of the epicenter. So that really puts us on the map to show just how vulnerable and just how impacted our communities are right now tackling COVID-19. Some of the things we've also been addressing is that, a majority of Filipino networks primarily are healthcare workers, and that, we recognize that they are the backbone to the healthcare industry. And so we recognize we really want to ensure that our healthcare workers are protected and have, safe conditions while they do this very essential work of serving patients and sick folks. We also wanted to address too that there has been an uptick of a lot of racial tension and some anti-Asian sentiments towards Asians. And so while we recognize that it may feel like our essential workers are going out there and they might be confronted with this, we want to ensure that we are looking out for each other, protecting each other, and also want to ensure that we find ways of how to tackle that in a safe way, either by upstanding for ourselves or for each other. So that's definitely something that we hope to achieve. So this was the flyer that we originally had sent out, sharing that in the true Bayanihan spirit, and the Bayanihan spirit can mean a lot of things to a lot of people. For me, it really meant that when I, first came to the United States, that we didn't know anyone, and so we really just found ways of making our neighbors and our friends our family, while we missed our family abroad. So we put out a call saying that we wanted to offer mutual aid for our neighbors in the New Jersey and New York area, and as well as the consideration of getting personal protective equipment for healthcare workers. And so we're definitely considering our frontline healthcare workers, the essential workers, elderly and immunocompromised. And so we had flyers both in Tagalog and in English. So through this campaign, we aim to basically just make sure that the information that's coming out, because it's so exhausting and it changes all the time, that we are delivering both resources and services to the folks that really need it. And also we recognize that, what the World Health Organization is sending out, or, even the issue of masks from if people should be wearing them or not, that was also changing a lot. So we want to ensure that our community is given, reliable and accurate information, because, even online, we always have to fact check. I do try to tell folks that aren't that savvy online that, like, be wary of like scams or, like chain letters and things like that. And so it's really important to have accurate and reliable information. And again, as I was sharing that, in the collective spirit of the Bayanihan, like we just want to ensure that our community feels like they're seen and heard, because oftentimes right now, and especially in this situation, we are more inside, and so we really aren't able to connect with each other. So tonight, that's one of the initiatives what we'd like to do, and as well as casting out a call to really want to ask of each other what is our own capacity that we can offer. If there's other groups that we know of, or other organizations or businesses or etc., even grants that are available and government agencies that would want to partner with these efforts. We were even invited by the commissioner, the deputy commissioner of New York City, who was part of the Community Relations Bureau this week. And so to get into our what are the components of this campaign, there's so many moving parts, but at the same time, not to overwhelm anyone, there's very specific ways that we can each share our shared collective knowledge in these ways. And so I'd like to invite each of the folks that are part of these committees to be able to share and highlight what are the responsibilities or expectations and characteristics of joining such a committee. I'd like to start out with research and education. Can I ask Zara to speak, please? If you'd like to
Yeah.
introduce yourself.
Hi, Zara.
Hi, Zara.
Hi, Zara.
Co-leading research and education with Mike Luat. We have been on calls this last couple of weeks, just basically trying to get everybody updated on what the committee is. Basically, we're planning on putting together some materials, some proper materials for the Filipino community, ensuring that we are constantly informed of, what COVID is, like myth busting, and also what we can do as a community. So yeah, it's an ongoing committee at this point, and of course, even post some of these things kind of dying out, there's still a lot to be done within that particular committee. So yeah, so if anyone is interested in joining, we usually meet once a week, every Sunday.
Thank you, Zara. Can I ask someone from services to share a little bit about this committee, please? Is it going to be Michael G?
Yes. Hello, everyone. Michael G. from the Services Committee. So we help organize community response teams to help deliver the basic needs that our kababayans need during this time, whether it be groceries, medication, or other needs, as well as building a pool and network of volunteers and existing services to disseminate to the community so that they can have these references in order to get assistance and to really get the aid that they need during this time.
Thank you, Michael G. Do you want to share a little bit about Meal to Heal?
Yes, sorry. Yes, so this is a project in collaboration with Little Manila Queens, Bayanihan Arts, a project commissioned by the Laundromat Project, NAFCON Northeast, and the Filipino American National Historical Society, Metro New York chapter. So we've done 3 deliveries so far, and as an examples, right, at various health institutions, we've helped to deliver meals to many essential workers on the front lines. And yeah, if you'd like to learn more, there is a website. We will be giving the information letter. And as the next picture showed on the next slide, May, we see that the community has come together to really feed our frontliners at the end of the day.
Additionally, I'd like to add that what makes this this initiative really wonderful is that it's both a mutual aid for local restaurants that are also Filipino small businesses. And while, because the economy isn't so well, they aren't getting the same business that they were before, we're able to, provide this mutual aid for small business Filipino small businesses, as well as show our support to healthcare workers and healthcare facilities that are also locally as well. And we will still have about another 7 to go. Can I please ask for someone to highlight the Committee for Action and Advocacy? I believe it's Ozzy.
Hi, yes, sorry, I was having issues on meeting. Okay. Hi, Azrael Dean, or folks call me Ozzy, use they pronouns. And I'm one of the leads, or one of the folks in Action Advocacy Committee. And this is really to, be part of the advocacy campaigns to ensure that we are protecting the rights and the well-beings of especially our frontline health workers, undocumented people, workers, elderly, and any other most vulnerable communities at this time. And this is really to also understand and deepen the understanding what we need to do in order to move forward into action. So if folks are interested in like doing advocacy work and action work and really being hands-on, this is a great committee to join.
Yeah, and I'd like to highlight this graphic on the left is a healthcare workers survey that we've been putting out, because we do know that healthcare workers are really sacrificing themselves in really difficult conditions. What is the patient to healthcare worker or nurse doctor ratio, and what is available? And so while we ourselves are not going out there, we want to begin asking and investigating what are the experiences of our Filipino healthcare workers. And so please, if you could share this around, it would be really helpful, and it will also help us know what is the most immediate need currently, because it changes week to week. So it'll be really helpful if folks could please circulate this healthcare workers survey. Can I please ask someone to share about the resource mobilization?
Hi everyone, this is Anne-Marie. I'm helping to lead the Resource Mobilization Committee for this campaign. So we're essentially care of mobilizing resources, both monetary and in-kind donations, for the relief of our community, so that we are essentially coming up with some of the resources that are supporting the Services Committee to be able to go out and ensure the well-being of our kababayan at this time. Particularly trying to secure PPEs. We're partnering with various grassroots organizations that are already doing distribution of PPE and have connections to vendors to be able to send it to those who are on the front lines. And we're also, as part of our initiative, is to develop this Bayanihan emergency fund, which will go toward developing care packages for folks during this really isolating period. And yeah, so folks should join if you're interested in fundraising or just gathering and compiling resources. We could use more folks on our committee.
Thank you, Anne-Marie. Well, I will also share about outreach, since it's basically as the co-coordinator responsibility along with the committee, because again, I'm just one person, but I definitely want to emphasize that we could use all the help that we can get about really being able to share out what are the available resources and services that NAFCON can help provide our community. So as part of outreach, we are trying to ensure that we're getting the information out to the people that need it in all the various ways that people get information, as well as, getting to know and meet other folks who are doing similar work or have also been able to find out what's happening in other boroughs of New York or other areas in New Jersey that we can't necessarily ourselves reach, but be able to build relationships around those matters as they develop. Part of outreach committee is also providing the different updates that happen. As I said, things change from week to week, and so it's important that we get updates. Another great thing about outreach is that it's a wonderful way to say that, yes, this is a very difficult time for that a lot of us are experiencing, but it's really powerful. Again, it's the power of Bayanihan to say that as a collective community, we are doing a lot of things to help each other, and that we shouldn't be afraid to be asking for help, and that, so that no one is left behind in this really difficult time. So we're able to share that with each other, our neighbors, friends, etc. As well as also letting folks know more of this like experience of being of the Filipino community to a greater area. So it's really important for us to ensure that we're sharing this with media and the news, and that they are able to report. We have seen a lot of highlights about Filipino healthcare workers in the media, so we're going to continue to do that in outreach. So we are now going to get into, now that we've covered all the committees, again, I'd like for all of you to reflect on different ways. Now you've seen the 5 committees, of different ways that you can engage with these committees. Again, it's structured in a way so that you don't feel like you have to do everything, and that like every little bit helps. So even if it's just about, I have an idea, I have heard this, by any means, it can definitely fit in one of the committees. So I'd like to go into, yes, I'm just going to read some of the questions and some of the issues that we'll be tackling this evening, and that some of our resource speakers can expand upon. But again, I welcome you to write any questions that come up into the chat box so that we can talk about it at the Q&A a little bit later. So we'll be talking about, an overview of what COVID-19 is, how we're able to protect ourselves. We'll also be learning a little bit more about what is the experience of frontline healthcare workers right now, and also be able to address concerns around paying rent. It's April 28th and May 1st will be just around the corner, and so we really need to think of options of how we'll be able to provide for ourselves if we're not actually working, if people have become unemployed recently, et cetera, et cetera. And finally, we'll be really just trying to brainstorm and think about how we can support each other here in New York and New Jersey, and the Filipino community at large. So we will begin with our resource speakers. Mike Lua, would you like to introduce these are our 3 speakers, Dr. Ryan Huerto, Dominique Flores, and Laura Gregory Esquire. And our first speaker for the evening will be Dr. Ryan Huerto. Back to you, Mike.
Okay. So a little more about our first speaker. So Dr. Huerto was born in the Philippines. He grew up in Southern California. Currently, he is a family medicine physician and national clinical clinician scholar at the University of Michigan. He earned his BS in psychology at UCLA, an MA in urban education policy and administration at LMU, MD at UCSD, and MPH at Harvard, TH Chan School of Public Health. Currently, he is a research fellow studying racial, ethnic, and disparities in diabetes counseling, youth perspectives of HIV and PrEP, youth preference for medical encounters, and structural competency in medical education. More broadly, he is interested in health equity and workforce diversity, data disaggregation, aggregation, and social justice. More also too, he is a part of a member of the Association for Filipino Scientists of America, where they are trying to use STEM, which is science, engineering, and math, to actually come together to help out the Filipino community. And now I would like to introduce Dr. Horto.
Hi, everyone. Can you confirm that you can hear me okay?
Got it.
Okay, great. My internet's a little spotty, so let me know if I break up, and then I'll be happy to repeat myself. Thank you for that introduction. I just want to start off by thanking NAFCON for creating this space and for inviting me to speak alongside two fantastic speakers. I also really want to acknowledge all the essential workers out there and the frontline healthcare workers, especially our Filipino nurses, who are risking their health and making it possible for us all to get through this. So thank you very much for that. Before I start talking about COVID, I do want to start with a little disclaimer that this is intended for educational purposes and not as medical advice. So if you start to feel sick or if a loved one starts to feel sick, I advise you to seek medical care from your healthcare provider, okay? So we'll start with a general overview. So what is the coronavirus? And it goes by different names: COVID-19, novel coronavirus, SARS-CoV-2. It's a virus that's part of a family of respiratory infections, except this is a brand new one, which our immune systems have no innate defense against. And it was first identified in Wuhan, China, and then quickly spread around the globe. So how is it spread? COVID-19 spreads from person to person through inhalation of air droplets. So imagine if someone coughs or sneezes very close to you, it's possible to catch it that way. It's also possible that it's spread by touching surfaces containing COVID-19, followed by touching your nose, your mouth, or your eyes. What are the symptoms of coronavirus? So people who have coronavirus who become symptomatic tend to develop fever, dry cough, shortness of breath. They can also develop headaches, aches and pains, sore throat, fatigue, loss of smell, and sometimes even diarrhea or a runny nose. I also want to emphasize that some people with coronavirus don't develop any symptoms or only very minor symptoms. So out of those symptoms, the ones I want to highlight are fever, dry cough, and shortness of breath. But again, everyone has the potential of presenting differently. So who is at risk? Everyone can potentially catch coronavirus, assuming that they're exposed to it, but some individuals are at greater risk of serious infection than others. For example, elderly individuals, people with diabetes, heart disease, lung disease, obesity, and a weakened immune system are at increased risk of a more serious infection. So what does it mean to be immunocompromised? This means that your immune system is weaker than normal and that you're at increased risk of a serious infection. This can be due to a chronic medical condition, such as cancer, or it can be from taking medications that suppress your immune system, such as steroids. How long does coronavirus last on surfaces? So the current evidence suggests that coronavirus can last anywhere from hours to days on surfaces. Some quick statistics, and some of these were mentioned already. I'm gonna highlight New York and New Jersey since that's where our organizers are from. So I took this data from reports by the CDC and Johns Hopkins. The Philippines has nearly 8,000 confirmed cases and 530 deaths. The US has over 104, almost 105,000 confirmed cases and over 55,000 deaths. Actually, that count is likely an underestimate for confirmed cases. For New York alone, there's over 287,000 confirmed cases and over 55,000 deaths. For New Jersey, there's over 111,000 confirmed cases and over 6,000 deaths. For California, where I'm from, There's over 43,000 confirmed cases and over 1,700 deaths. And if you follow the CDC and Johns Hopkins, those statistics are being updated daily. So how do you protect yourself? So first and foremost, practice physical distancing, keeping at least 6 feet of distance between yourself and others. Don't touch your face, as hard as that is. Wash your hands frequently with soap and warm water for at least 20 seconds. One way to do that is by singing happy birthday while you wash your hands. Coughing and sneezing into the inside of your elbow instead of your hands or into a Kleenex. Clean, frequently touch surfaces daily with disinfectant, or more frequently if they become dirty. Stay at home, avoid unnecessary travel. Wearing a mask that covers both your nose and your mouth can help protect others. Anytime you're outdoors or in public. If you take medications, try to have at least a 1 month to 3 month supply on hand. And then if you become sick, as I said before, make sure you contact a health professional for advice. So how to protect your community? This was mentioned before as well, but providing mutual aid to one another, checking in on your loved ones, on your neighbors, while also maintaining physical distance, making sure that the more vulnerable members of your community have enough food, groceries, and medications. And remember that you can pick up prescriptions for loved ones. If you feel comfortable and you witness an act of racism, intervening upon that, standing up for your community. And then how often should you wash your fabric mask? According to the CDC, you should be routinely washing your fabric masks depending on the frequency of use. And avoid touching your face after touching your mask. Wash your hands immediately after removing your mask. So there was a question, can you reuse your blue masks? I'm assuming this question is referring to surgical masks, N95s. So in general, before the pandemic, to give you a frame of reference, as a healthcare provider, we would change masks between patients, but obviously the demand now for the masks has gone up while the supply is limited. So you'll now see healthcare providers using masks for longer periods of time. And there's no exact studies showing the exact duration that you should be wearing them. But as a general rule of thumb, if the mask becomes wet or damaged, that's a time to change it. In terms of myth busting, I'm just gonna go over some myths to try to debunk them. So the first one is related to things that were brought up earlier in terms of racism and xenophobia. And that's that the virus itself is inherently an Asian virus. It's inherently an immigrant virus. And a lot of this has been perpetuated by racialization of the virus, calling it the Chinese virus, the banning of immigrants, the scapegoating of immigrants. And I want to demystify that and say that everyone has a potential of catching and spreading coronavirus. The next myth I want to debunk is the myth that it is race and not racism that's leading to the health inequities that we're seeing in minority communities, specifically Black and brown communities. So the reality is that it's not race. There's no inherent genetic risk factors as far as we know. It's structural racism that's causing these dramatic health disparities that we're seeing. The next myth I want to debunk is that only older people get sick from coronavirus. While they're much more likely to have serious infection, we do have rare cases where younger, presumably healthy individuals are becoming very sick from coronavirus and in some cases even dying. So the next myth that I want to debunk is that drinking or injecting bleach or disinfectants will cure the disease. It will not, but it will harm you and potentially even kill you. So don't do that. The next myth I want to debunk is that summer and warm weather will magically make the virus go away. We simply do not have enough information to know that yet. And we're also on top of that seeing the virus in places with warmer climates than the US, such as the Philippines. So the next myth is that the coronavirus is just like the flu. And this is something I've heard patients say This is something that was said more often, I think, earlier on in the pandemic, but we're realizing that it spreads much more quickly and it's potentially even more deadly than the flu. But we won't know for sure because we don't have an accurate count of how many people have gotten it total across the world. The next myth I want to debunk is that if you get coronavirus, you'll then become immune to it after recovering. We simply don't have enough information on immunity yet to say this. And the next myth is that by inhaling hot steam, that's going to protect your lungs. We have no evidence of that, and this may also damage your airway and your lungs, so don't do it. The next myth is that coronavirus is airborne. So what does that mean? Airborne means that the virus would be able to stay in the air for very long periods of time. As far as we know, it's passed through air droplets, and that if you're 6 feet away or more, that should protect you from catching it from someone else unless you touch a surface. But there is concern that certain medical procedures, such as intubating patients, which is putting a tube down their airway to breathe for them, or using nebulizer treatments can aerosolize coronavirus, making it more dangerous in terms of being inhaled. And that's why you're seeing healthcare providers performing certain procedures wear N95 masks. So I want to go through all those ones again, just to be absolutely clear so there's no misinterpretation. So the virus is not inherently an Asian virus. It's not inherently an immigrant virus. Anybody can get it. Anybody can pass it on. It is structural racism and not race that's leading to the health inequities due to coronavirus that we're seeing in Black and brown communities. While older individuals are at increased risk of serious infection, there have also been cases of younger people becoming seriously ill and in some cases even dying from coronavirus. Do not drink or inject bleach or disinfectant. It's very dangerous and will not cure coronavirus. There's no evidence that the virus will go away in the summer. We need more information on this. This is not just the flu. As far as we know, it spreads much more rapidly and is potentially more lethal than the flu. There's no proof of long-term immunity yet. We still need more information to see how the immune system is going to build long-term immunity against it. Do not breathe hot steam. There's no evidence that protects against the coronavirus. And then as far as we know, it's passed through air droplets. And from what we know, it's not airborne. So I can send a link to y'all of some frequently asked questions that are answered by the CDC, as well as a guide of what types of disinfectants work on surfaces to kill the coronavirus. I also want to send a map by Johns Hopkins and the CDC in terms of state tallies. So if you're not from New York or New Jersey, you can look up those statistics, as well as a global track or a global monitoring of cases, including the Philippines.
Thank you, Dr. Ryan Huerto. Yes, all those resources will be very helpful, and we'll make sure that we circulate that as well after the webinar. So thank you again for sharing all that very pertinent information. Our next speaker is Dominique Flores. She's a frontline healthcare worker at the New York Presbyterian Weill Cornell as a COVID ICU RN. Prior to the pandemic, she was originally a general pediatric RN. And outside of clinical workspace, she continues to look for ways to be an innovative and contribute in improving the care of COVID-19 patients, as well as advocating for Filipino healthcare workers' solidarity in the face of Asian xenophobia related to the stigma in the spread of the virus. As a recent graduate of Rutgers School of Nursing, she has been involved in nursing student organizations on a university statewide level and is passionate about matters relating to healthcare. She's a community member of the NAFCON Bayanihan response to COVID-19. She's also a volunteer with the Kalusugan Coalition, and as part of her personal drive to become more involved with the Asian American and Filipino-centered health topics. I now present to you Dominique Flores. The floor is yours. Welcome.
Okay, thank you. Can you guys hear me?
Good.
All right, perfect. So thank you for inviting me and creating this space for us to come together as a Filipino community, and it's such an honor to be here with other notable speakers. And as a frontline nurse, I want to say thank you for all the love and support that you've given to nurses everywhere. But I also want to give a shout out to those who are working from home, whether you're in IT or finance, and supporting healthcare workers from behind the scenes, and all the businesses and volunteer groups that are contributing their time and effort to support us by sending PPE and meals, which we're truly grateful for, because sometimes we don't get to go outside to like get food for ourselves. So to describe my experience of what it's like to work in ICU during COVID, I have to say it's been quite like a roller coaster. As mentioned before, my background prior to working with COVID patients was I was working in general pediatrics, and much of our patient population was pediatric cancer patients who are immunocompromised. And in the early stages of COVID, our adult units were pretty much assigned to care for these patients. But what was alarming to us was how we were always told something new on a day-to-day basis. There was always something new regarding how the influx would be managed. And ultimately, it was really exhausting and confusing on our end because we wanted something concrete and solid. But we've learned to adapt and grow with the process, and we realized at some point we were going to have to take on these assignments as well. And it just happened that where as the growing number of confirmed positive patients continued to flow into our hospital, the decision was that 3 out of our 4 pediatric units were need to be converted to COVID-19 ICUs. So imagine going from taking care of cancer patients to be told that you need to take care of COVID patients. So our concern was not just the fact that we were going to expose our pediatric patients, but the fact that were we knowledgeable enough to be able to take care of the acuity, and also if the staffing ratios are going to be safe for us. And especially because we want to make sure as much as possible that we give the best care that we can so that these patients have the best outcomes. For those of you who don't know, and it depends on the facility, typically newly hired ICU nurses require at least the bare minimum of 9 to 12 months of training to be considered competent in taking on their own assignment. So I want to see it as an opportunity to expand my nursing skill set so that I can possibly contribute to the pandemic in a positive way. But there's also this feeling inside as to whether will I really be competent enough within the 2 weeks of orientation I have to be able to take care of them. But you'll be surprised in dire times and needs a moment that under pressure and an immense focus, you'll learn so much in so little time. But I also have to attribute it to the staff nurses who've been precepting me in the adult medical ICUs and the surgical ICUs, where the really intense patients are. They've been such great preceptors and wealth of knowledge. And essentially all the staff nurses in my unit became oriented in adult step down and ICU units for roughly 2 weeks so that we can learn how to give the proper care. And I truly appreciate my facility because I know other hospitals in New York City that I can't speak on behalf of, like, due to their brand, but we at least got orientation on how to be able to give the best care possible. So we were learning how to take care of complicated drips with sedation, paralytic agents, vasopressors, different ventilator settings. We even had to learn in the spot how to do renal replacement therapy, which is something that usually dialysis nurses know how to do. But the thing is, there was also a shortage of dialysis nurses. So essentially we were functioning as almost like taking care of everything. We were learning about new clinical trial medications and equipment, but the good thing is at least there's some comfort in knowing that you have some knowledge and foundation so that you can have the best patient outcomes possible. But the learning process never stopped there. And even after the orientation, there was something new every day. Was this medication working? Is this effective enough? Do we need to change our protocol? And essentially what we were finding out was along the way, not just with their respiratory symptoms were being exacerbated, but we were finding about how fast they clot, their coagulopathy. So they were going to multi-system organ failure where their heart was affected, kidneys, their pancreas, the liver, and sometimes in idiopathic cases where we don't know the cause because they might not have the typical cases of having hypertension, diabetes, or chronic obstructive pulmonary disease. Some of them, they're relatively healthy, but all of a sudden they start to have a stroke. So there are things that we're learning on the spot in the moment, and it's just that we're just learning how to do it on the spot. And like I said, the beginning was rather rough in the transition. Not gonna lie, we were seeing multiple deaths per day and per shift that we were starting to feel like, were we ready for this? But over time, it's definitely have improved. Like the statistics show from our hospital that we've had over 5,000 patients discharged in total. So that's was like a silver lining out of all of this. And every single extubation in which they have the tube come out and discharge that occurs, we clap to celebrate the small successes and the progress we make, because it shows that what we're doing is actually truly working at the end of the day. So in regards to the major issues and working conditions, in the beginning, there was definitely a concern regarding staffing and access to PPE. But then with the help of all of these donations, like we were able to secure enough PPE for a long term for the next couple of months. But we're still not sure about how the second wave or as to when it'll come affect us. With relation to the staffing ratio, so our facility recruited help even from the West Coast, Mid-State, and Upstate New York. So we have nurses coming from the Cleveland Clinic, Cayuga Hospital, UC San Francisco, all coming to like volunteer and dedicate their time to help with the ratios. And it's been really great to see people coming over to help us out. And we're truly grateful for that. Now, in regards to the mental health, there was actually just an article released this morning about one of the top ER physicians who recently just committed suicide. And honestly, we just received an email about it as well. And it's actually really sad to hear that. I can't speak on the exact experiences, but from what my friends say who work not just in our ER, but like in ERs also in New Jersey and New York, it was very overwhelming, especially in Elmhurst. I'm sure you've seen the video. It was overwhelming and beyond what they expected. Their ratios were beyond what they could like handle. And I feel like there needs to be a better way for healthcare workers to seek getting mental health treatment without the stigma attached of being, I'm a doctor, I'm a nurse, can I see a therapist, can I have someone to talk to about what I'm going through, what I'm seeing. And we're already far into the first wave that we're entering the part of the pandemic health footprint where we're seeing the effects of the fourth wave hit, which is like the economic injury, the burnout, the mental illness, and the psychic trauma. So with the isolation as well, with the family separation, I'm lucky and I'm actually blessed that I have to say that I'm not living at home with my Lola. She lives in another house. But I know other Filipino nurses where their Lola and Lola are at their primary home or primary residence. And so what they've decided to do was they take the hospital housing or the hotel residence so that they can protect their kids and also the elderly family relatives from not contracting the disease. And at first it seemed like a great benefit because yes, we're being provided housing, but over time it gets really lonely for them. And so they're trying to use FaceTime as ways to cope and get in contact with their kids and family members, but it only goes for so much as what you can do. So for those of you who are wondering what are ways we can advocate for our healthcare workers, if you know somebody that's like living in a hotel or away from home, just reach out to them and ask them, are they doing okay? Maybe just send them a little bit of money for like coffee or something like that, because being away from family for a while does start to get to them. And certain thoughts start to go through their head, which is the reason why one of the programs I think NAFCON has with like Meal to Heal program. For those of us I know who are Filipino nurses, we actually miss the taste of home really badly. So we love seeing Filipino food come onto their units because sometimes what we need is just a taste and comfort at home to feel like we can cope with the rest of the night or the rest of the day. Now to tackle personal experiences with anti-Asian sentiments. While I haven't experienced it personally, I've had friends in New Jersey in the early stages where all these isolation protocols weren't set. I've had friends who had patients tell them, I want somebody else. I want someone else to take care of me. You're a Chinese nurse. I don't need this. And I was actually really appalled to hear that because that stigma of it being just solely coming from Asia and it being called the Chinese disease, it was just, oh, how can you refuse care when we're really trying to take care of you? And so one of the things I started with the Kalusugan Coalition was a social media campaign called Nandito Kami, in which I wanted to really strengthen the Filipino healthcare worker solidarity in the midst of all these Asian xenophobic issues, to show that although we're Asian, although you may think that we are Chinese and that it's coming primarily from this area of the globe, we're still coming to work, we're still showing up to take care of you guys so that you can stay home, still be with your family, and to enjoy that moment that you have. And yeah, that's pretty much been my experience so far.
Thank you, Dominique, for sharing all that. Really appreciate you giving us like a firsthand experience of what it is like in hospitals. But again, we want to really thank you for your service, for your dedication to your patients, and really your ability to adapt at such a high rate of really having to adjust at the different things that you've been experiencing. So thank you very much for sharing that.
Okay. All right. Just a reminder too, if you do have any questions, we do ask you to go to the more and chat box, and please enter your questions there. Again, at the end, we're gonna actually be looking at these Q&A questions and actually having the speakers, acknowledge these your concerns and questions. So up next, we have uh, Lori Gregory, Laura Gregory, Esquire. So she's going to be covering moratorium on evictions and rent matters. So more about Miss Laura Gregory. So she's a lawyer with an extensive experience in practice of law. After handling cases like the Vizconde massacre and the Ongpin kidnapping cases in the Philippines, uh, she also implemented the demutualization plan of the Philippines stock market exchange. She headed to New York to take the bar after pursuing further studies at Harvard Law. Um, she is also a proud alumni of UP and started out in New York doing immigration litigations. She maintains a full service law office in Manhattan and has represented individuals in landlord and tenant cases um, and estates in surrogate court, and does pro bono work through Center for Legal Remedies. She is also part of the Filipinos for Good Governance and a board member of Kinding Sandao, which is a cultural organization that asserts, it reclaims, preserves, and recreates the legends, epics, myths, and unwritten history of the Philippines. More about her: she lives in Queens with her husband, with her lovely dog, Burby. All right, Laura, it's all yours.
Thank you so much for the generous introduction. And I wanted to thank NAFCON before we jump into into the eviction moratorium. I wanted to say thank you to NAFCON for organizing this Bayanihan. I'm glad to be a part of this Bayanihan, lalo na sa panahon na ito ng krisis na may salot na umaatake sa ating komunidad at maraming tao nagkakasakit, o may sakit or nagdadalamhati. So I am with you in this. And I also wanted to thank the other panelists, Dr. Ryan and Dominique. I salute you for the work that you do. And with that, let's jump right in. So right at the start of the pandemic, there'll be no enforcement of either an eviction of any tenant, residential or commercial, or a foreclosure of any residential or commercial property. So this was in March 2020, and 90 days from that is about mid-June, June 18, 2020. So for our purposes, we are limiting the discussion to residential evictions. You know, in New York, getting a tenant to evict is primarily a judicial proceeding. So landlords cannot just lock the doors, change the locks, or remove the properties of a tenant so that they can be evicted. They actually have to really go to court. That's why it is very, very important that we have this eviction moratorium so that at the height of this pandemic, nobody will lose a roof over their head or will be concerned that they will not have a place to live. So what happens in mid-June when there's no longer a moratorium on eviction? Well, there are pending legislations right now. One of the proposals is with the city council. The city council actually effectively proposes to prolong the moratorium on evictions by blocking marshals and sheriffs from taking property or executing money judgments. So this is pending, you know, and we don't know. Maybe we can ask the council later. I think one of them is in the audience. Stephen Raga, I think, is watching, so he can probably update us if it's already been passed or what are the chances that it will be passed. At any rate, so what's important about that pending legislation is that it even includes more money judgments. So at this time of the pandemic, people are losing their jobs or have lost their jobs. They are not only they are not only having difficulty paying their rent, but they're having difficulty paying their bills, the credit card debts. So it's important that with the city council, they're proposing, okay, so until April 2021, or effectively a year, we will have a stay on collections of both rent and debts. Now, with the New York State Senate, there is a proposal to suspend the rent payments for 3 months, and after which that is actually a rent moratorium. They're proposing that after a period of 3 months, then the tenant is no longer liable to pay for the rent. We don't know if it's going to be passed, because I think they're still they actually have to meet to pass the bills. Let me take a look. What slide are we in? I can't see. Sorry, guys. Yeah.
We are on the third slide about housing stability and tenant protection. Oop, Laura, you're on mute. We cannot hear you. Let's see if I can. There we go. Okay, go ahead.
Yes. Yes. So one of the great things that was enacted last year was the Housing Stability and Tenant Protection Act. So our interpretation of the moratorium, eviction and moratorium, should be in conjunction with the Housing Stability and Tenant Protection Act. What does this mean? So number one, previously there was sort of like a blacklist. If a person has been involved in like a court case, in housing part, then no landlord will ever rent to that person. But now, because of the Housing Stability and Tenant Protection Act that was enacted, there is no more blacklist. You cannot be refused a lease just because you had a court case before. And then one of the important things is actually the security deposit has been limited now to 1 month, whereas before it was 2 months. And I think the most important thing is that it's now misdemeanor for a landlord to unlawfully evict or lock out a tenant. Meaning, so for instance, the doors are locked, they change the doors, then that's going to be a misdemeanor, and it's like just the minimum penalty is a fine of 1,000. So it's gonna hurt them where it's gonna hurt them, like their pockets, right? So I know a lot of people are saying, well, I mean, it's a moratorium on eviction, it's not actually rent, right? So what we've noticed in the community also is not a lot of people are aware that there are programs like SCREE, which is a senior citizen rent increase exemption, which is available for our kababayans who are at least 62 years old and who are earning, no more than 50,000 and are paying like a third of their income on rent. And this is New York. I think everybody is spending more than a third of their income on rent, unless they're in a rent stabilized or rent controlled apartments, right? So that's also in conjunction with the DRIE. You have the disability rent increase exemption. So if a person has a disability, and that includes diabetes, which is like a prevalent health concern in our community, the Filipino Americans. We love our sweets, we love our leche flan, so polvoron, I don't know, there are so many desserts, wonderful desserts in our Filipino community, right? So are there one of the interesting questions that, of course, important questions that we've received actually is, so attorney, if I can, is there any way that I can reduce my rent? Well, under the law, there are actually circumstances where the rent can be abated or reduced, especially when there's a violation of the warranty of habitability. And these are really the crucial, particularly in New York, where a lot of people even in our community, particularly in an immigrant community, where they don't want to complain. They don't have heat, they don't have hot water, or the landlord, in an effort to evict them, would reduce the heat or cut the electricity. So those are all illegal. And if the tenant is experiencing that, they can withhold the rent. So how do I do that, attorney? So you need to document that. You need to establish that this is happening. You cannot just do it. You cannot just do it and then ignore it. And then all of a sudden you're faced with a letter from the lawyer of the landlord, or you are facing eviction charges. So there's a website actually where you can file your complaints. It's actually an online complaint, 311 online. You can complain there, and the New York City Housing and Preservation Development, which is a city agency, will actually go to your apartment and inspect. Of course, they encourage that you will also address the complaints to the landlord so that it can be addressed first. But this is actually a really crucial agency, because especially for those that are rent controlled or rent stabilized, or if there's a senior member in your household, because they would really inspect and they will really document it. In fact, there's a link between the New York City Housing and Preservation Development and the state agency, which is the New York Department of Homes and Community Renewal. Usually, the state agency relies on the city agency in enforcing those violations. So, for instance, in the case of people who are receiving SCRI or DRI, if they have a complaint, or there is something that's violated in their apartment, there are repairs that are not made, then they will report it to the New York City Housing and Preservation Development. Actually, even the state agency will suspend payments to the landlord, because when you have a senior citizen rent increase exception, it's $1 per dollar rebate on taxes for the landlord. They're actually getting money and in their pockets. So that's why there's a working relationship between this city agency and the state agency. Of course, the most important right of tenants would be the right to organize. So a lot of our community members, a lot of Filipinos, they are reluctant to complain, but it's very specific in the law that the landlord cannot prevent you from organizing. Neither can the landlord harass you for complaining, or do something vindictive in terms of the services that they're providing when you complain. So there are actually a myriad of options that are available to our kababayans. Hang on a second, let me just take a look at the slides.
Sure, we are at, I think, one of the last ones of yours. Yes. So
Okay.
we're at the
Yes.
final thoughts about, yeah.
All right. So I will stop right there, and I will encourage you to ask questions, because, all this matters. It's a really lengthy discussion, but we've covered the important points. You cannot be evicted right now until at least the middle of June. And when eviction happens, it's a process where right now, because of the amendments in the law, there should be a certified letter sent to you about your non-payment of rent. And then after the case is instituted, there should be service of the summons. And these are very detailed. One mistake in the service of summons to you, it can be dismissed, and the landlord has to start all over again. All right. Okay.
Thank you, Lara. Thank you so much
You're
for
welcome.
sharing all those things. It's really important. We're now opening up to the Q&A. It sounds like we have some questions. While I'm still getting queued up with some other questions, I am going to start with Brian. There's a question here for you. It says here, is there enough data showing whether history of smoking or vape may risk serious infection or higher? There's one more question included in that as well. It says here, Is it better for you to wear gloves in public, or are you more at risk of the coronavirus with the gloves on? And if you contract COVID, once you're at risk are you at risk of reoccurring infection?
Right. Can y'all hear me okay?
Yes.
So it's still very early, and there's going to be a lot more information in regards to the link between smoking and vaping and risk of increased or worse infection due to coronavirus. But the early evidence that we're seeing does suggest that a history or an active history of smoking, vaping is potentially harmful and can lead to worse infection. I actually included a link to a systematic review of the evidence so far looking at this, and it does suggest that if you smoke or previously smoked, you're at increased risk of a worse outcome due to coronavirus. And the second question was about wearing gloves. The way I think about wearing gloves is that if you touch your face, it doesn't matter. It's the same as not wearing gloves. And even in the way that you take the gloves off, let's say you don't touch your face and you have gloves on outside. Whatever you touch with your gloves, you have the potential to transfer coronavirus onto whatever you touch. And the way that you remove the gloves in medicine, there's a special way to remove gloves where you don't touch the outside of the gloves. And if you're touching, let's say you take off one glove and then you're touching the other glove with your bare hand, the gloves, it kind of defeats the purpose of wearing gloves, if that makes sense. So the main thing I want to emphasize is wash your hands frequently, wash your hands thoroughly, and don't touch your face, okay? So you don't have to wear gloves, but you have to wash your hands frequently, you have to wash them thoroughly.
Sorry.
And the third question, remind me what the third question was?
Anne-Marie?
Yeah, the third question was, if you have contracted COVID once, are you at risk for a recurring infection?
Immunities. So we don't have enough evidence yet if there's long-term immunity, and scientists are working on developing tests to test immunity, because really you can have antibodies develop after or during infection, but after time it's possible that antibodies will wear off and you can become reinfected. And this is so new. We know so little about coronavirus. It's hard to say if our immune systems are going to develop strong long-term immunity against it, because we haven't had the time to study that yet. So for that, I would say there's a question mark. We don't know yet.
Thank you.
So it looks like we have more questions for the other speakers too. For Dominique, sorry if I'm saying it wrong. What are commutes like, and what are other ways the Filipino community can support healthcare workers at this time from your perspective? And there was another question too, if you want to try answering a couple at a time. How has your employer been able to assist and prevent any further harassment of any anti-Asian sentiment toward healthcare workers? For example, ways to protect you when you travel to and from the hospital.
So in regards to that question with the commute, so because of the fact that social distancing is in place and that there's certain lockdown hours, the traffic back and forth, because I still live at home with my parents, and the only thing is what we do is we do very strict protocols on how we decide to clean ourselves when we come home. I come home in a different set of outfits, and I keep my shoes in a silicone cover so I don't bring home the pathogens into the house or anything like that. In regards to going back and forth, it's actually been not so bad because the traffic has been much more smaller compared to before. For the question regarding employer being able to assist, so the thing is I haven't experienced the actual situations myself. It was just my friend in New Jersey who works as a nurse in another hospital. But because of the fact that they already started implementing visitor restrictions very early, we were just pretty much taking care of the patient. So there hasn't been any issues so far regarding harassment. And in regards to protection back and forth, we actually have buses for the nurses who are in certain hospital in housings, or if they're going to specific hotels that are being provided by the hospital or sponsored. So it really helps out if they need to go to the boroughs or anything like that, or for anywhere else that they live. That way they don't have to deal with the issue of going through public transportation or taking Ubers, which are really expensive right now. They're like $20, $30 at this point, because they want to make sure that like it's just isolated to that one person. And what was the other question? I think I'm missing one. I think there was one more question. I just couldn't figure out which one was missing.
I think we have to, there she is.
Yeah, I got it. Let me see. Yeah, and the last question had been, how has your employer been able to assist and prevent further harassment of any Asian sentiments toward healthcare workers, such as like ways to protect you when you travel?
Okay.
From
for protection, we can report it to our patient care director and bring it up further as escalate as we need up the clinical ladder in chain of command. But as of right now, I can't. I hadn't had that experience, so I'm not sure what the entire process is afterwards.
Awesome. Thank you for your answers. More questions are coming in. So for Lara, are landlords able to increase rent during this pandemic period? Don't they have to legally give notice to tenants first?
That's correct. Yes. They can't raise rent right now, not yet. And if ever there's a rent increase, they need to give notice, 30-day notice for those who have leases of a year. And for 2 years, it's 60-day notice. A lot of the existing provisions have been amended actually because of the 2019 law that amended these provisions. So yeah, they're protected. I think there's also another question about, I was trying to get into the chat questions.
Yeah, there's a couple more here actually. So someone also asked, what if the landlord says I can't use my deposit right now, as well as are landlords getting mortgage forbearance forgiveness in this time?
Yeah, I think that's one of the questions that were raised by the tenant organization groups, because in that in the executive order, those who own property got mortgage forbearance. In fact, there's already a Department of Financial Services already released the rules on that. Yes, but then again, the eviction moratorium, it doesn't only cover those who are landlords. You know, sometimes there's a roommate situation, and in fact, the ones who's the roommate, the one who has the lease, and the roommate is not paying, the one who holds the lease can't also evict the roommate. You know what I'm saying? So it's not always a case where it's an owner of a property. So the landlord-tenant relationship does not only cover that situation. It can be just, you know, a roommate, and one holds the lease, the other doesn't hold the lease. So yeah, in answer to the question of whether those who own properties have mortgage forbearance, yes, they have a 90-day period to do that. There's a lot of questions about the implementation, so they're still sorting it out. But yeah. And the other questions, remind me again.
The one last question I saw was, what if the landlord says I can't use my deposit right now?
So in that situation, you can ask or have someone draft a letter for you and demanding that it be used for your current rent, you know. Yeah, and so even the courts now are actually closed except for emergency relief. For the housing part, it would be situations like emergency repairs, or there's like a lockout that was done by the landlord, you know. So, and this will be in effect until the court says otherwise. Because what has happened is that there's a coordination between the office of the governor and also the office of the chief administrative judge. So even if there is a cost to evict, or even if they want to file an eviction case, the courts are closed unless it's emergency relief. Yeah. So in answer to that specific question, a demand letter will do for that. Yeah.
Awesome, thank you. It seems we have maybe one more question for each of the other speakers, and then I'll have one more question for everyone at the end. So for Ryan, there was a question, at what point is a COVID positive person no longer contagious?
Okay, can you hear me okay?
Mhm.
So according to the CDC, there's at least 3 criteria. So when it's safe to be around others and ending home isolation for someone who has coronavirus. So the first requirement is you have to be fever free for at least 72 hours. And on top of that, your other symptoms have to have improved. For example, if there's a cough or if there's shortness of breath, all those symptoms have to be improved. And the other requirement is that at least 7 days have to have passed since your symptoms started. And that's if you have developed symptoms. If you think you've come into close contact with someone with coronavirus, I do want to note that the incubation period for the virus can be up to 14 days. So anywhere between that window of 0 to 14 days, it's possible that you'll eventually develop symptoms. So if you're just quarantining, but you don't know if you're coronavirus positive, the safest bet would be to wait 14 days, assuming no symptoms develop, to make sure without a test that you're coronavirus free. So I hope that answers your question.
Awesome, thank you for that information. And then for Dominic, do people coming into the hospitals have to pay for treatment related to COVID?
In regards to paying for the treatment related to COVID, I'm not sure exactly how it works because I don't know if it's based on their health insurance. So I'm not sure if I'll be able to answer that question.
Yeah, or if any of the other research speakers have an idea.
Can you repeat the question? Sorry.
Yeah, it was, do people coming into hospitals have to pay for treatment related to COVID?
They can't be refused treatment, and usually what happens in the hospital is that someone from the billing department usually goes and would ask the family, if someone came with them, do you have a credit card or do you have like insurance? But usually the patients should just stand grounded. I don't have any of these things, but you cannot refuse treatment. You cannot refuse me treatment. And eventually they also are able to say that, oh, I won't be able to pay for it, but just, I'm going to apply for either SSI or of any other of the benefits.
Great.
Thank you.
Yes, and I think the final question really for all of you is, in general, how do you cope up emotionally when you see and hear all the negativity in the news and the media and television? Any thoughts on that?
Well, you have to put boundaries on things, so that requires also self-assessment and self-awareness. So if we listen to the news, it's good to stay informed, but then if it also pulls you down, then you have to learn how to listen to your body, how it says. If you're able to if your breathing gets tight, then it's already an indication that you need to take a break from that. So that's what I do. I sort of limit the time that I listen to the news. I spend time meditating also and dwelling on things. I look at, if you can see my background, it's sort of like green trees, so just so that it's easy on the eyes. Hey, everyone is having a difficult time right now, and it's just great that because of Bayanihan, we are able to channel our energies into something constructive. But then you're right, we have to be aware that we need to assess ourselves. If the breathing becomes tight, then that means take a break. And always reach out to somebody else. This is a community, and that's why we are in community. We have to remain in community. We have to reach out to someone. You can say however you feel, or you can check with somebody else as well.
Awesome. Thank you for that insight, Lara. Sorry, Ryan also had wanted to add a little bit of an answer to that previous question about payment, and then we can return to this question about how do we emotionally respond in this time.
So regarding payment, I just want to add that there's a law called EMTALA that makes it so that you cannot be turned away from the emergency department.
Yeah.
But there are instances where folks have been turned away from urgent care clinics or outpatient clinics, and you can receive a bill later on. And one of the things that
Correct.
determines that is Medicaid expansion. Like, are you in a state that has expanded Medicaid and increased the safety net for lower income individuals? So that's a major factor on whether or not you'll get a bill and how large your bill will be.
Awesome. Did you want to also answer the question about emotion, how to emotionally respond or cope in this time, or should I hand it off to Dominique? I guess Dominic, if you want to give your answer.
Okay, so I'm speaking as in my experience being a new grad nurse who started in August. And so one of our ways for coping mechanisms that I do is I like to just talk out with my other friends I graduated from nursing school, because we're all going through the same thing, but in different units. So I'm working in ICU, whereas some of my friends are working in med surg. And that could be where the patients are more awake, where they're not intubated. And we're all talking about our experiences of what we're seeing. And it's nice to talk to them because we feel that sense of community and bond that, oh, it's us that understands what we're going through. So making sure that you have a social group to go back to so you can talk about your experiences is really helpful. But also at times, I'm not gonna lie, in the beginning of COVID, I felt like I always need to know something more, like there's something else I need to do. So what I've been doing on my own spare time is looking up ways in terms of technology and how we can improve, like health IT, informatics. I started participating in different hackathons and things like that because I feel like there's so much more that we can do in order to contribute to the pandemic.
Thank you. What is a hackathon?
So a lot lately, I recently joined a MIT COVID-19 Beat the Pandemic hackathon, and there's another couple ones coming up in May and June for other institutions. But basically, you collaborate with different other healthcare professionals all across America, whether they're remotely, because it is a virtual hackathon. So you can be collaborating with epidemiologists, data scientists, graduate students, whether they're working in engineering. It could be even material engineering or actual computer and software engineering. You can also be working with other physicians who are either more experienced or also who are residents. So you're all in one team trying to figure out what's a way, and you're like in a group where you're paired with a task. So amongst the tasks, it could be how to care for COVID patients at home for those of them who are not in the acute care setting. Or you could be working on data collection. How can we get, because one of the things we're worried about right now is there's not enough evidence on actually how to treat these patients for the best outcomes. So one of the prompts was, what's a better way to expedite the data so that there's more clinical trials and better clinical guidelines so that these patients can have better outcomes. So for me, I feel more at ease when I know that there's something else I could do. So that's why I like to spend my time in that way.
Thank you, Dominique. Ryan, did you have a response to that last question? And then there's actually one more question in the chat box after.
I'll keep it very short. Just kind of, for me, what's helped is leaning on my community and staying connected with them through technology. And also, to a certain level, like pouring myself into my work. I'm very privileged in that I'm able to do my research from home.
Nice.
Also understanding it's also okay to have days where you don't have to be productive. Like you can just focus on your wellness and watch TV or Netflix, or go for a physically distanced exercise. So that's what I have to say on that.
Awesome, thank you. And the last question I think is for Laura, because it's tenant related. So can the landlord or tenant in the building demand you to leave if you are to be found COVID positive?
Absolutely not. That's discriminatory, and actually we need to inform people that they can actually call and document and call the New York City Commission on Human Rights, and they will actually act on that complaint. And remember, they have the power to impose penalties and fines on people who are acting in a discriminatory manner. For instance, any agent of the landlord who would say, oh, you have to leave because you are COVID positive, you're an illegal alien. By the way, that's not right. Nobody can say an illegal alien now, because the new rules of the New York City Commission on Human Rights prohibit that, and they will actually incur a penalty when they do that. So no, we shouldn't only stop. We should not only report it in social media. I understand that people do that a lot, but take it a step further and report it.
Awesome. I think that is all of the questions so far in the chat box. Thank you all for your time to really answer all these questions super comprehensively from your experiences. I'm going to hand it off to May and Mike now to finish us off.
Thank you again. So I'd like to share now that we've spent an hour and some together talking about what different parts of our community have been experiencing and witnessing, and what it's been affecting our community under COVID-19, there are different ways of engaging in this campaign. So one of the ways that we were sharing earlier is really consider in what area could you be able to offer yourself or want to get involved. Is it through research and education? Is it through services? Is it through action and advocacy? Is it through resource mobilization or outreach? So again, just maybe take some time to consider of these different things, and we recognize that they do overlap, so that's also understandable too. So, but again, that would be really helpful if folks want to join. One of the very important things about getting involved in the Bayanihan response to COVID is that we need to know who needs the help, where they are, what they need, if it's groceries, if it's medication, if it's helping with transportation, possibly people who have cars. So again, you can volunteer to be able to help out. Folks who will be willing to be able to do these kind of daily tasks from different areas. We're looking for folks in Queens and the other boroughs as well, but I think that we've started because we know a lot of Filipinos in Queens, but we recognize that Filipinos are everywhere, and in New Jersey as well. So please consider that. Also being able to request those needs. So, if you want to request it for someone from your church or someone that is your neighbor 3 doors down that you don't necessarily want to interact because they might be immunocompromised. So you can also request support. You can email us. That is the phone number. You can text us, and it actually goes to several of our Alliance affiliate members to be able to react and respond in an immediate way, and we can coordinate that. Another way that we had also mentioned is that we really advocate for our healthcare workers, our Filipino healthcare workers. And so in order for us to understand what's happening, even though we're not actually out there in the hospitals or seeing what's happening firsthand, we really want to know from them what is the immediately currently, because it keeps changing. And so we want to ensure that we're responding to healthcare workers, Filipino healthcare workers' immediate needs. Also wanted to share that we're actually collecting an emergency fund. This is donations that will go to Filipino families, healthcare workers that are in need during the COVID-19 pandemic. So please, if you would like to donate to this emergency fund, is another way of plugging in. We also have Giving Tuesday has now been bumped up to May 5th. And so what we're trying to do is we have a goal of about $1,000 to provide care packages for about 30 to 40 families. We're specifically looking at families who are undocumented, who are too afraid to leave their home because if there aren't essential workers, they might be asked, what are you doing out? Where are you going? And they're very afraid. So in order to still let them know that they're remembered and that, Dominique was also talking about comfort food. We were wanting to compile like a small little sinigang, like meal thing or adobo, just so that, if folks aren't able to access those kind of things, that, we are trying to share and say that we can do that for them. Mike, did you want to try also share a couple?
Oh, there.
Yes.
Sorry, I couldn't unmute myself. So basically, we do have this new campaign. Nationally, our alliances have found, the NAFCON has found a bunch of J1 workers that are going through some impact in the crisis. So basically, with the economy like slowing down, basically, some J1 workers who are actually supposed to be here for studying reasons, but are, they are here to like intern or whatnot. They might be like seasonal workers. So they're here to kind of study and learn from some work experiences. So during this crisis right now, basically they're being affected just because a lot of them are left hanging. Their job providers who they work for are no longer using their labor. So a lot of them are being impacted and not having like ways to actually support themselves or to get food or even pay their rent or things like that. So we do have this national campaign. So we just want everyone to know, if you do know anyone who is going through this crisis, please let us know. And you could basically email us. It's also on our Instagram, so you should look for it there. All right. So again, this is one part of the series that we're actually doing. We want you guys to join us next month, basically on Wednesday, May 13th, 7 p.m. to 9 p.m. The topic we'll be discussing will be actually, our committee is going to be coming together and figuring out what should we be doing next. I know there's like people who have contracted COVID, and so there have been people, we're also in touch with people who have survived it. So one of the part of the series is we're going to try to figure out how people have survived it. What are some tips and tricks they can, they can help us with, because of, you might not have all the proper support needed if you can't see your doctor or whatnot, and you might be turned away to the emergency room. So that's that for the next one. There are going to be other ones like how to apply for unemployment and things like that. Just because these are things that we're all struggling through, and a lot of our community members have expressed. So we're trying to support them, with these webinars that are going to be coming up. All right. So the last two parts, basically, we want you guys to actually stay in touch with the community, just because, if we keep ourselves strong, we also strengthen our community by helping them out. So reach out to your family and your friends, your neighbors, and give us a call if you do need the support needed for that. We do urge you guys to email us at NAFCON, NAFCON.ne@gmail.com, or you can give us a call or text at 929-314-4612. You could also join our Facebook group and get involved via the link tree below. All right, and then again, it's been a pleasure. Thank you guys again for joining us. This is one part of one series, and we strongly believe that in unity and cooperation, to achieve our goal and to create lasting change, we embody collective care for our Filipino community, to help and to assist each other, not only in the times of need, but also in times of victory and celebration. So our resilience and people power channels the spirit of Bayanihan. So thank you so much for joining us tonight. If you guys do have any questions, Want any other ways to get involved, again, email us, or you can reach us at any of these social media sites below. Thank you so much for your time and have a great night.
Thank you, everyone. Stay in touch. Be safe. Take care.